Hello everyone, this is Kate Warnock coming back to you live from day 2 of MediFuture. I'm the social media manager for GuideWell. I'm delighted to have with us here today in the GuideWell Insights Lounge, Leva Lesson. Leva, welcome to the interview.
Thank you.
Leva is the CEO of CareMore Health System and has traveled a long way to be with us, so we're excited to have her here. Leva, let's get right into the questions. You have a very long experience in the industry where you have certainly seen health IT evolve. Can you tell me what role does it play in the CareMore system of delivery?
Certainly, for much of our recent lives in healthcare, the role that IT has played is a data aggregator and a transactor. But where we're headed for sure is for data to do two things. One is to constantly monitor effectiveness, and the second is for data to be fed real time into various kinds of applications, mostly emerging as mobile applications, in ways that clinicians can make point-of-care decisions, immediately communicate with family members, other members of the care team, and make sure that the patient's experience is as coordinated as possible. Coordination has become a much overused buzzword in our industry over 20 years, and the power of IT today, I think, is to make that a reality and not a sort of a bureaucratic process.
So I would say along with that, coordination is certainly critical, but so is collaboration. You have a very unique perspective in that you've been on both sides of the house. You've been with the payers, you've been with providers. Can you explain to us what role do you think is necessary for those two to come together so that we're sure that consumers are winning with the highest quality care at the most affordable price?
Well, the payer-provider collaboration, I think if it begins with economics, and I know that right away our minds go economics equals profits, and that's the trap we've gotten ourselves into, I think. I think that if both the payer and the provider think about the right economic construct for healthcare. Payers are, after all, the stewards of the funds, if you will, and I think we all are coming to be pretty clear about how payment mechanisms affect behavior, how they drive resource utilization that may not be efficient, how rewards can be so powerful in driving the right outcomes. So if we think of economics in those sort of classic liberal arts kinds of ways, how do we drive desired behavior, desired outcomes, we can have phenomenal collaboration between payers and providers. I think also payers and providers need to quit arguing about whose patient it is or whose member it is, and rather say that they are jointly accountable for the outcomes of that individual, and to feel free to be segmented in that regard. Certainly the healthcare needs of a 20-year-old and a 70-year-old are quite different, and our products have started sort of segmenting, Medicare products, exchange products, but if we kind of take it out of a product construct and look at the segments of individuals and the place they are in their life and their health status, and we do that together and then go back to product design, I think it's another place of great collaboration.
Right. I think it harkens back to your first response, the role of health IT. The payers have certain information on the consumer. The providers have more information, and you get the best of both worlds when you join and share that information. You really get a more complete vision of who that patient and that consumer is. So another point I think well made. You know, you had spoken earlier, Leva, about the comparative metrics of clinical care and how important it is within the CareMore Health model for you to know what is working and how do you change that system when it's not. Can you speak more to comparative metrics and how that might impact population health?
Well, certainly comparative metrics, at the root of it is what are you comparing, what's being compared to what? And so at CareMore we have focused on two kinds of comparative metrics. One is team-based comparative metrics. We capture about 135 clinical metrics, and when I say clinical, I really do mean clinical. They're not utilization metrics. They're things like at what rate is the GFR score of our kidney patients changing? At what rate is the blood pressure of our population being managed? So we accumulate about 128 of these metrics, and we compare neighborhood team to neighborhood team. So we say, how is blood pressure being managed in Richmond, Virginia versus Nevada, Las Vegas, Nevada, for example. We have 18 communities that we're measuring across, and we have found that to be phenomenally powerful. Nobody wants to be the worst manager of blood pressure, but relatedly, it reinforces part of our culture, which is this. For much of my career, I have heard people say, well, CareMore can't be effective in fill in the blank of a city because healthcare here is different. The healthcare system is different. And for sure, there are major regional variations in healthcare. But from our point of view, blood pressure management is blood pressure management is blood pressure management. It doesn't matter if you're in Cincinnati or Tampa or Los Angeles or Las Vegas. And so it helps us reinforce the power of the patient's clinical need. The second place that we are starting to increasingly spend time on comparative metrics are our own clinical results over and against the published best practices in academic journals. So if an academic journal article comes out, for example, that says that engagement of a social worker in helping manage stability of dementia patients proved better outcomes than the non-social worker involved situation, and they, most academic articles have quite a bit of data in them, then we compare our own data to the data in the academic articles, and can we achieve the same outcomes that are being shown to be able to be proven in academic settings. And that's another power of comparative data for us.
It's a fascinating conversation and how you apply that, because we had a conversation earlier today about how it makes more sense. I think it was with David Friedman was talking about how scientific studies are drafted and the results that are published aren't always useful. They could even be misleading. And his point was we have to apply it to real world situations. Yes. And I think what you're doing clearly is real world, and you have the right infrastructure, and you're measuring the right things that are actionable. So I think that's fantastic. Another thing that's so unique about the CareMore model is your team care approach. And clearly you have gotten a lot of positive results from that. My question for you, though, Liba, is team-based care isn't always taught in medical school. It still might be. I think that we had Rashika Fernandopoli spoke earlier, and he's talking to his Harvard medical students about the clinician doesn't always have to be the center or the I'm trying to remember the word he used, but the captain of the ship. In your experience, how is it that you identify a physician that you want to hire into the CareMore model? How do you know that person's a right fit for CareMore?
Well, that is the heart and soul question of our success, because as we go into each new community, we need to recruit a team of physicians that wants to live the CareMore model. And it's a controversial way to practice medicine, because if we think about it, the better a patient does, there's somebody economically losing. If we save a patient's foot and they don't need an amputation, the wheelchair company doesn't sell another wheelchair. I mean, positive healthcare outcomes challenge the traditional healthcare economy. So we need clinical leaders that can do two things. One is articulate what I just said and be able to constantly stand on the evidence and the outcomes and be sure of them. But this notion that you raise about team-based care, we interview for it strongly, as you might imagine. We have many multidisciplinary players interview physicians. So our advanced practice nurses, our social workers, our behavioral health specialists, they all interview the physicians. And the degree of comfort that those physicians have in recognizing the clinical talent and the clinical, sort of the elevated clinical status of those individuals is a major part of selecting them. And you can tell in the interview if they're comfortable. Now, someone's predisposition and comfort with that team-based model still needs to be reinforced. And going back to your first question about IT, I didn't mention it then, but I'll mention it here, that being able to share information and almost in a semi-social media sort of way, that the clinicians can all be speaking to one another in a secure environment about a specific case, that helps reinforce the team model. And technology has really helped us advance team-based care because of the ability to all be looking at the same data at the same time, message each other about it, And technology has helped us elevate our team concept.
Absolutely. And one thing that I know I'll just reiterate, and I'm sure is true of the Care More model, the testimonials that I've read on your site, is that the physicians themselves have such a rewarding experience because they're able to focus on that part of medicine that they trained for, that they're passionate about, yet they can depend on the physician extenders, the rest of their team, to deliver the other expertise that might be necessary for caring for that patient.
Yes.
So I'm sure that's something that you, when you are recruiting, you can certainly emphasize.
Yes, and we relatedly, many physicians love being teachers. They may never be an academic, but they love the idea of teaching. And so there's a part of their role that is teaching their team clinical medicine. Mm-hmm. So it's partly their job to make sure that all those advanced practice clinicians and extenders have the highest ability and knowledge in managing any number of aging-related conditions. Mm-hmm. It's a very motivating thing for the advanced practice clinicians, but it's also an enjoyable thing for the physicians who do like to teach.
Absolutely. So maybe along those lines, Libby, can you address, you work specifically with a senior population, and some of them might have habits that are ingrained over a long period of time that your teams are now challenged with modifying. Can you tell us, how do they address making those changes in a way that's impactful, yet obviously respectful to the patient that they're working with?
That's a really good question, and we stumbled into this one a bit because there's a bit of resignation sometimes on the part of the clinical delivery system. We've adopted this word about compliance. The patients aren't compliant. And so we had a chief medical officer who's since retired, but he was active 7-8 years ago, and he kept challenging that word. And he said, what if we made compliance our problem and not the patient's problem? What would that change about what we do? Well, we started on things that seem simpler and more straightforward now, but things like someone not taking their medication, if you actually ask them why, sometimes it's very solvable. Sometimes it's, my hands can't open the cap, I forget, it's a $30 copay and I didn't have it this month. So if it becomes the job of our clinicians to solve those pieces of the problem, then we can make a dent in compliance. Now, there are much more deep-seated behavioral kinds of issues that habits, lifetime habits that need to be broken, and we have found that the power of education is phenomenal. So to give you an example, in diabetic foot care, we have a remarkable amputation rate. It's about 80% less than the Medicare fee-for-service average in amputations. Some of that is truly clinical in the sense that we have very advanced wound care programs. But really, our big aha was we have a program we meet with our members in their first 30 days of enrollment. It's called Healthy Start. And in the Healthy Start exam, if someone is diabetic, we ask them about foot care. Sure. And 50% of people that come to us with diabetes have never heard that foot care is important. So it's shocking, isn't it? So if you start there, and in a very human, simplistic, no doctor speak way, say, any break of the skin on your foot, come here the next day. How simple is that? Right. But what that does to totally change the way wounds are managed is pretty radical. More deep-seated kinds of things around lifestyle. We do have behavioral counselors, we have nutritionists, and we kind of hound people. Come talk, and that's where the multidisciplinary team also has some value. I'll say one other thing about habits and compliance, and that is particularly in the oldest segment, people over 75, over 80, the role their children play in their own compliance. We can talk to people all day long about a low sodium diet, which, by the way, say salt, not sodium, and they might get it better, but we say a low sodium diet, but they live with their daughter and their daughter's cooking all their food and it's not low sodium. It doesn't matter that we told the patient. So we've learned that part of all the behavior change is getting their whole circle of care involved in behavior change.
That's an excellent lead into my next question. You know, we had talked earlier with another one of our wonderful speakers that health really is social. It is not, and not social as in Facebook and Twitter, as much as that's a role, but it's your circle of caregivers, it's your family, it's your support system. You know, and I really appreciated when I visited the CareMore site that you have a special section just for caregivers.
Yes.
And I think that's a really critical piece that I think might be missing from a lot of the traditional care delivery. Can you speak a little bit more as to why you do focus on the caregiver as much as you do the patient that you're serving?
And the last example is
Right.
certainly one.
Right.
I thankfully, at my age, I still don't have memory problems. Every now and then when I lose my glasses, it comes to me, but I can go to the doctor one day, and one of my sisters can say, "What does the doctor say?" And I know I only remember a certain piece of it. Now, fast forward 30 years, and even without dementia, just general decline of memory, what we expect people to remember is overwhelming. And so we actually have a bad game of telephone. Remember when we were 6 years old and you'd whisper something in someone's ear, and by the time it got somewhere else, it was different. So we realized that information going from us to the patient, to the family, to the second family member, to the third family member, and then we'd get a panic call, you know, what, my mom's having a heart attack, like, what are you talking about? So we realized that we could do everybody a favor by getting information out in a shared way. But also, we, notwithstanding the fact that it's a whole social system, we've really encouraged our patients to pick one family member that can be our partner. Bring them with you to all your visits, include them on your emails, and if we can get that one person, that maybe two, some families need it to be that way, but let us really have a partner with a family member, then we can help empower that family in a very coordinated way. And the more complicated things get, we already have a relationship with the family member. And we have found that to be so powerful in making complex care decisions, because often what happens in normal life is all the simple stuff happens without the family, and they come in on a major decision, and it's confusion and anger, and if we can be with them on the simple things, then we can partner on this on the significant events.
I can only imagine that that must significantly reduce the anxiety that, you know, that if you're caring for an older adult, you know, all of us have experienced that, and so to be part of that treatment plan, you know, really from the beginning, I think is so logical, and it's also humane, because, you know, we want the people that are taking care of our loved ones to be as informed as they should be to ensure that the best care is consistently delivered. So
one of my favorite letters, if I could share this, that we receive a lot of letters from caregivers, but one of my favorite ones was a letter from the son of one of our members, who he and his wife each had an elderly parent being managed in two different systems. The son's mother was a CareMore patient, and the daughter's mother lived out of our area, was a patient in another system. Both had very complex medical decisions. And he wrote me a letter basically saying, CareMore's good for our marriage, because there was so much tension brought into the marriage about travel and bad information and crises. And in the CareMore scene, the information was there, the crises were mitigated, and so I thought, you know, there's more than one kind of mental health that we're improving, and if CareMore care of a senior can improve a marriage, you know, great.
That's terrific. Well, Leva Lesson, you have been a fantastic interview for us today, and I'm so glad that you were part of the GuideWell Insights Lounge. Thank you, and this is Kate Warnock, Social Media Manager for GuideWell. I look forward to joining you again soon.
Hi everyone. The changing world of healthcare gives people control, responsibility, and more choice, but many have less confidence in what to do next. Health is personal, and everyone's needs are different. People are looking for a complete solution that's simple, addresses all their concerns, and fits their lifestyle. That's why, at the beginning of 2014, we introduced GuideWell to the marketplace. At GuideWell, we are building a new world of health and healthcare resources, collaborating with and creating a spectrum of forward-thinking companies that offer a broad range of health-related products and services, integral and useful to people's everyday lives. With our experience and broad view on how to improve the cost, quality, and access of healthcare, we advocate for a better system while reimagining and reshaping the future of health and healthcare. GuideWell is a mutual holding company and is the parent to our family of companies. These companies, which are focused on transforming healthcare, include Florida Blue, Florida's Blue Cross Blue Shield plan, which provides innovative health solutions and insurance plans to the people of Florida. Florida Blue has served Floridians since 1944, offering an array of health and wellness products and services to fit the individual needs of those we serve. GuideWell Health focuses on transforming the delivery of care and delivering superior health outcomes and experiences to patients through new, innovative care delivery models such as GuideWell Emergency Medicine Doctors, a full-service, standalone medical facility serving the Orlando metropolitan area. GuideWell Connect, our marketing and retail services business, helps clients connect with their customers and provides them with the support they need. And Diversified Service Options, which provides administrative and claims processing services for state and federal healthcare programs such as Medicare and Medicaid. Our family of companies are guided by the same mission of helping people and communities achieve better health. The same vision, to be a leading innovator, enabling healthy communities, and values to guide our behavior: respect, integrity, imagination, courage, and excellence. Through innovation and collaboration, we are forming an integrated ecosystem of products and services which will enable consumers to better manage their health. We believe that by empowering and engaging people, we can improve not only their healthcare experiences, but also the overall affordability of care and individual health outcomes. The only thing certain about the future of healthcare is that it's changing, and changing fast. It will constantly be a moving target. We have created and positioned GuideWell to not just meet demands today, but to meet, anticipate, and create solutions for the future. That's the future of health.
Perfect, sir. Thank you.
Welcome back, everyone. This is Kate Warnock coming to you live from day 2 of MediFuture. I'm delighted to be here today from the GuideWell Insights Lounge with Dr. Kevin Sneed. Kevin, welcome.
Thank you. I'm really happy to be here.
We're pleased to have the founding dean and a professor at the USF College of Pharmacy. And I wanted to ask you, Dr. Sneed, you started this program for University of South Florida, the pharmacy school. What is it that you see changing about the pharmacy program to deliver the pharmacists of the future? Do you see them becoming more of a physician extender? Do you see them playing a more prominent role in consumer care?
Well, the first thing we need to do is get the pills out of the hands of the pharmacist. When you really get down to it, the job of the pharmacist never really was to put a pill in the bottle. And we assumed that responsibility, decades ago. But,
right.
But now we really need to get back to patient care, patient engagement,
right.
Physician engagement, work with nurse practitioners, PAs, and really become much more of an interprofessional team environment.
Well, I think that's, it fits so beautifully. It's as if you've been listening to all these other interviews because team-based care really seems to be an overarching theme that we're hearing from more of the innovators that are here at MediFuture. It is about, it's about patient education, it's about patient engagement, and you need all sorts of disciplines involved in that to make sure that the care experience is what it really should be.
Well, when you really get down to it, we have a burgeoning problem right before us that we can barely see. Our baby boomer population, 75 million individuals, preparing to enter Medicare enrollment is really going to put a lot of stress on the current healthcare system. One thing that we really need to focus on is how do we put each patient at the center and surround them with key members of the healthcare team.
That's right. Well, so, looking at your experience, Dr. Sneed, I know that healthcare disparities is one of your passions,
yes,
and really solving for that. So you even ran a program right here in Tampa that addressed minority populations.
yes.
I was wondering if you could tell us a little bit more about that work.
Yeah, that was called the InShape program. It stood for the Intercollaborative Student Health Assessment and Project and Evaluation.
Say that fast.
It's a mouthful. Yes. It's a mouthful. But the whole idea was the fact that, I got tired of going to health fairs and talking with individuals and never having any follow-up, never knowing if we changed their lives, if we had any return on the investment.
Right.
We tried to build a program that would actually go in, build a relationship with various entities in the community, and then have a longitudinal behavioral change program that hopefully would wind up having an impact on the overall and the outcome of health for each individual that we impacted.
Right, and I'm sure it was a successful program.
It was. Some of the programs are still ongoing today. We're very pleased with that. We collected a lot of data and we learned a lot.
Right.
And now we're kind of, we're preparing for part 2, and we're going to roll a lot of the mobile health technology directly into health disparities. We're going to take that information and those technologies directly into communities,
right,
so that we can collect information and connect them to health in a way that we haven't done before.
Bringing it right to the consumer makes so much
Absolutely.
sense, doesn't it? So you are the founding dean, and I'm sure there are plenty of potential candidates who are going to be watching this video and want to know, what qualities do I need to have to be accepted into your program?
Well, one of the main things that we're really looking for are people who are really passionate about health. That want to focus on pharmacy as a portion of health, but we're not looking for individuals that want to come in and just have a job. We're looking for people that want a career.
Right.
We're looking for emotional maturity, emotional intelligence. We're looking for people that have a passion for that want to be courageous and look for new ways to extend health and be leaders in changing health. If you're looking at pharmacy the way we've done it for a 20-year period now, USF is probably not the location for you, because we're looking at it in the rearview mirror, but we're moving forward, and we want people who are coming here that want to move forward and help us change health.
Right. Well, I think that's a great lead into my next question for you. I think that pharmacists are really, you're so close to the consumer. You see firsthand what a pharmacy treatment can do.
Yes.
And you also know how expensive it might be, the financial impact on that consumer. What is it that we can do to address, the creation of new drug therapies so that we're not inadvertently creating more of a health disparity? What role do you think that a pharmacist plays in that?
Well, I can tell you right now, one thing that we're doing is really delving deep into personalized health at the DNA level with pharmacogenomics, and really trying to figure out who are you as an individual. What medication would work best for you? What medications should we probably avoid? We need to get away from population management where we treat 100 people the same, and hone in on each individual. And I think pharmacists are uniquely positioned because of our training and our clinical pharmacology training, our communication skills, our ability to really be at the center of healthcare, whether it be your family physician, a specialist, a nurse practitioner, dietitian, that can really communicate and bring those individuals together so that we get the best regimen to optimize health and not just exist in health.
So it certainly seems to me that, if anything, the pharmacist is going to play a more central role to consumers' health care. I think that you're probably the right person in charge of a whole school of pharmacy to help make sure that those students are just best in class. So I really want to thank you for being here with us today, Dr. Sneed.
Yeah, I'm very thankful. I'm very thankful to be here. We've had a wonderful conference. We've made a lot of very great connections here. And one thing I will tell you, I'm still a clinician, and I'm still in there with patients. And so I think that brings a realism to our curricular development, our enrollment in terms of going out and recruiting students, and then interacting with the environment to create a very innovative and and forward-thinking programs.
It seems like you bring a very end-to-end perspective on what it is.
That's exactly what we want to accomplish.
So fantastic. Well, we're delighted to have had you here today in the GuideWell Insights Lounge. I'm Kate Warnock, Social Media Manager for GuideWell. Thank you again so much. We'll be looking again to see you soon.
Thank you.
Hi, everyone. The changing world of healthcare gives people control, responsibility, and more choice, but many have less confidence in what to do next. Health is personal, and everyone's needs are different. People are looking for a complete solution that's simple, addresses all their concerns, and fits their lifestyle. That's why, at the beginning of 2014, we introduced GuideWell to the marketplace. At GuideWell, we are building a new world of health and healthcare resources, collaborating with and creating a spectrum of forward-thinking companies that offer a broad range of health-related products and services, integral and useful to people's everyday lives. With our experience and broad view on how to improve the cost, quality, and access of healthcare, we advocate for a better system while reimagining and reshaping the future of health and healthcare. GuideWell is a mutual holding company and is the parent to our family of companies. These companies, which are focused on transforming healthcare, include Florida Blue, Florida's Blue Cross Blue Shield plan, which provides innovative health solutions and insurance plans to the people of Florida. Florida Blue has served Floridians since 1944, offering an array of health and wellness products and services to fit the individual needs of those we serve. GuideWell Health focuses on transforming the delivery of care and delivering superior health outcomes and experiences to patients through new, innovative care delivery models such as GuideWell Emergency Medicine Doctors, a full-service, standalone medical facility serving the Orlando metropolitan area. GuideWell Connect, our marketing and retail services business, helps clients connect with their customers and provides them with the support they need. And Diversified Service Options, which provides administrative and claims processing services for state and federal healthcare programs such as Medicare and Medicaid. Our family of companies are guided by the same mission of helping people and communities achieve better health. The same vision, to be a leading innovator, enabling healthy communities, and values to guide our behavior: respect, integrity, imagination, courage, and excellence. Through innovation and collaboration, we are forming an integrated ecosystem of products and services which will enable consumers to better manage their health. We believe that by empowering and engaging people, we can improve not only their healthcare experiences, but also the overall affordability of care and individual health outcomes. The only thing certain about the future of healthcare is that it's changing, and changing fast. It will constantly be a moving target. We have created and positioned GuideWell to not just meet demands today, but to meet, anticipate, and create solutions for the future. That's the future of health.
Hi everyone, this is Kate Warnock coming back to you live from MediFuture, Day 2. I'm so pleased to have with us in the GuideWell Insights Lounge a very distinguished speaker, Dr. Marty Makary. Dr. Makary, welcome.
Good to be with you, Kate.
We're so happy to have you here. Dr. Makary is the author of the book Unaccountable, as well as the director of surgery for Johns Hopkins. Dr. Makary, let's get right into the questions for you. I'm wondering, do you think that today's medical residents are more willing to question their attending physician on their rounds because of Unaccountable?
You know, I think the conversation started by Unaccountable has been a really healthy conversation for a couple reasons. One, we were kind of raised in a medical culture where if you see something that doesn't look right, you kind of keep your mouth shut and maybe talk to your immediate superior, but you never really escalate anything. And now for the first time we're hearing stories of a nurse or a physician who was fired for speaking up, and it turns out that an internal investigation found that all their claims were substantiated. Right. And there's this sense of, why are we in the field? Are we here to help patients, or are we in this field to get the job done? And I think that overwhelmingly, folks feel like, you know, I want to be a part of a system that I'm proud of.
Mm-hmm.
And a system that harms 1 in 4 hospitalized patients, and a system where medical mistakes are the number 3 cause of death is not really the system I want to be a part of. So there's this incredible enthusiasm right now to take the ideas in Unaccountable, which were controversial when I put the pen to the paper, but now they're accepted and they're out there and they're highly esteemed as general virtues of American society: transparency, honest, open communication, that kind of thing.
So I guess then, do you think that in the 2 years since the book has been written, you know, you had positioned that really no one was in charge of medical care in the United States? Do you think that that has changed in these last 2 years?
I do. I think there's an intense sense of personal responsibility by hospital board members, by hospital administrators, to say, hey, look, if this happened, I want to know more about it, and I want to figure out how can we prevent this from happening again. I've seen this with our own administration at Johns Hopkins, where over the last 15 years, there's been this intense escalation to get to the bottom of adverse events and to fix problems so they don't happen again, like the Josie King preventable death, the death of a child. When that happened, there was an intense interest in getting it right. And we haven't seen that sort of reaction in American healthcare in previous decades. It's a new day. Ask any hospital CEO, what is your number 1 priority, and they will tell you patient safety.
Well, I think that's good for everyone. You know, I think that your checklist that you created and have since become widely adopted has really changed, you know, how medicine is practiced. Not every consumer, though, is comfortable with talking to their doctor and asking them, you know, how safe should I be with you? How is it that the average consumer can make sure that their physician has their safety first in mind?
Well, I think that, first of all, the checklist idea, I think, struck on a thirst for common sense things in healthcare, right? Healthcare is so polarized. Our country is so polarized in so many ways. Healthcare reform, so many other aspects of healthcare. Here's something we all agree on. We should be able to have a civil work environment and a civil conversation. And Dr. Pronovost came up with the idea of the checklist in the ICU. He said, hey, Marty, you should come up with one for the operating rooms. And it's subsequently been popularized and really gotten out there in the WHO. And several people have really been great champions. It's been refreshing to see people connect with a common sense idea. But really the idea is, how can we, you know, most important item on the checklist, introducing who we are and what we're doing before we do something, before we do an operation. It's restoring some dignity to the nursing profession. It's creating a sense of value to each member of the team. It's empowering folks to say, hey, if you don't see something that looks right, I want to know about it as the head surgeon for this room. Please let me know. And opening that dialogue early, turns out, is a terrific safety net for preventable adverse events.
That's terrific. So, you know, I know that you're also quite passionate about, you had already mentioned, transparency and quality. Who should be driving those quality standards? Is it the government's existing set of standards, or, you know, who is in the best position to really say this is how we measure and define what quality means across the healthcare system?
Well, Kate, I still operate 3 to 4 days a week, busy, complex, long pancreatic operations, islet transplant operations, and I think something that's given me as a perspective that we've got to keep the physicians in charge of healthcare. We need the doctors' groups to endorse the metrics of quality and say this is a logical and reasonable way to measure quality, and this form of risk adjustment is a fair way to risk adjust, because if you put a level playing field in front of doctors, they will outperform every time.
Right.
But when the metrics are crude and raw and imperfect, doctors are right in being concerned that we're going to unfairly punish those that discriminate against the tough cases and reward those that discriminate and punish those that take on those high-risk cases.
Right. Well, I think that's a great connection into my next question for you. You had recently commented on a story that ran in the Washington Post that was talking about a marketplace for operating procedures. You know, I think that's a whole new day for the type of medicine that might be explored. But I wonder, in your position, what is it that payers and providers can do to collaborate and offer more affordable care so that something that is as unregulated as a marketplace for operating procedures might be diminished?
You know, there's this intense public demand right now for price transparency, and soon to follow is going to be a demand for quality transparency to be coupled with that price transparency. That is, folks want to know that they're going to be able to deliver a baby, and the cost is going to be $8,000, including everything.
Right.
Parts and labor for 50 years, or whatever you want to think of it as a warranty.
Right.
And I encourage hospitals and CEOs to say, hey, look, maybe you want to set a fixed price for your gallbladder operations, assuming a patient meets reasonable criteria and they're not extremely sick.
Right.
There's a demand for that out there. People are paying out of their own pocket now with these high deductibles, and they want to say, look, if $8,000 covers everything related to that operation, I'm willing to pay for it. And they can factor in the risk and build in whatever formulas they want to give themselves the profit margin in the end. But I tell hospitals, set a fixed price for an operation with predictable risk, and let the patients just start rolling in. And we're seeing that internationally. We're seeing that now. If I told you, hey, you need to have a stomach cancer surgery, why don't you go overseas? You'd say, what, are you crazy? But what if I said, hey, you're going to have a dental extraction? How about this hospital in Costa Rica on the beach by the Four Seasons? By the way, it's a U.S. top quality hospital affiliate, and the doctors are from the U.S., all of a sudden, hey, it's a lot more appealing if you're going to save $10,000.
Right, right, absolutely. Well, you know, my final question for you, Dr. Makary, is you're quite active on Twitter. It's Dr. Marty, MD, and I'm wondering, what do you perceive as the value of that Twitter feed in you being able to converse directly with patients, consumers, other thought leaders? You know, tell us about your use of social media.
Well, you know, for a lot of folks, that is an important way to communicate. For me, I'm in the operating room most of the days. I'm not on social media, but when I get out, it's nice to hear the comments, the feedback from the book, the experiences that people have. You know, one of the greatest privileges of being an author is when you write down your own experiences, you get a flood of other folks sharing their experiences, and you learn so much, and you get to travel and visit hospitals and hear the stories of early experiments with safety that are incredible successes, and homegrown ideas that doctors have come up with. And that's the neat thing about social media, is it creates this dialogue, and it allows patients to communicate with me directly and say, hey, I heard, you know, this can be done. Do you know of an orthopedic surgeon in my area? And it's just a fun way to communicate.
So you don't necessarily see that as a draw against your time. I mean, heaven knows you don't have a lot of free time, but this is obviously something that you're willing to engage in because you get something back from it too.
Yeah, I don't always reply within 30 seconds like some folks, but you know, with enough with a 7-day turnaround allowance, it's a great way to.
You know, I saw a tweet from you. You were at a conference, I think, in outside of Savannah, and you tweeted that you love the Savannah airport. I was just dying to know. What is it that made you love the Savannah airport?
It was so comfortable, but you know, the funny thing about it was that the airport retweeted my tweet.
Of course they did.
So it's a kind of fun dialogue, you know, and sometimes you wonder, like, you know, what are we doing having all this chatter? But you know, there's a new movement in America to create a shared society where we share zip cars and all sorts of things. And I think the social media revolution is for the folks that like that kind of sharing culture.
Well, I think what it does too is, you know, you certainly have a lot of patients that are interested in who you are as a person, as well as, you know, other professionals, and this really lets them get to know you outside of the operating room or outside of a keynote address. So I think the value would be tremendous in continuing with that, and I'm so glad that you do. Well, Dr. Makary, we actually have a video that was produced when you wrote your book, Unaccountable, that we would like to go ahead and share with our viewers now. But I want to thank you first so much for your time with us today, and hope that you enjoy the rest of your time here at MediFuture.
Thank you, Kate. It's great to be here.
Thank you.
Thanks so much.
Hi, everyone. Thanks for coming back with us. We're live here from MediFuture. I'm Kate Warnock, Social Media Manager for GuideWell, and with us today in the GuideWell Insights Lounge, we have Christine Lemke. Christine, welcome to the program.
Thanks for having me.
Thank you so much for being here. Christine is co-founder and head of product for the Activity Exchange. Christine, you have a very distinguished background in technology and software development. You know what it means to invest in technology. You also know the pressure of when you have to invest in something to be compliant, like ICD-10. How can you help a provider know when is the right time to invest versus, basically how to prioritize their IT dollars?
It's a really big open question for lots of providers when you go in and pitch something newfangled, some newfangled technology, right? Because these things they just have to do. They have to find room in their budget for the ICD-10 stuff and other things like that. I guess the way that I think about it in a structured manner is there are things that you have to do. There are things that save money on the bottom line, and then there are things that drive revenue on the top line.
Mm-hmm.
And so if you're a technology company today, the more you can go in with, if you build this into your product and into your system and you invest in it, it will grow your top line. And that's how we try and speak to our customers.
That makes a lot of sense. So I know with the Activity Exchange in particular, you really leverage real-time data so that a patient's experience is going to be more robust and it's going to really help them manage their health. Can you tell us a little bit more about how that works?
Yeah, absolutely. So we try and find patients in what some of our customers like Humana call their moments of influence. And this emerges from the data when you see someone undergo a life change, or when you see someone, who maybe puts a status on Facebook that says, I'm going to get married. And these life events that happen drive us to take a little bit more control of our health, right? And start to engage with lots of different things, like maybe they'll download Runkeeper and start a running regime. Maybe they'll download MyFitnessPal and watch what they eat a little bit longer. And these are signals that someone wants to take control and ownership of their health. Mm-hmm. And so the plan, or some of our customers want to be there when those events happen and say, this is great, here's some more.
Got it. So I think a lot of the conversation here at MediFuture has been on, obviously, consumerism and being patient-centered. I think that the Activity Exchange made a very big point of saying that we are a human-centered design company.
Right.
What elements of the health industry do you think would benefit from more of this approach?
Yeah, a human-centered design is a bit of a buzzword, so I cringe just a little bit. But obviously, when you're designing solutions like ours, you really want to understand the entire context around each user, mm-hmm. not just the function that they want to get done.
Okay.
Right? And so what that means for this solution is when somebody wants to take control and ownership of their health, there are lots of other parameters in their life that are going to influence that, right? Their friends are going to influence that. Their lifestyle, like how much time they're spending at work, is going to influence that. Things like, am I on vacation right now and I just want to break from my routine, mm-hmm. are going to influence that. And so it's designing a solution where consumers can really have a lot of choice and a lot of freedom to sort of pick the right Lego pieces to build the routine and the formula that they need to keep healthy.
So that's a great lead into my next question. I think that would probably be a revolution in how people approach coding. And you yourself have been a woman entrepreneur in the tech field your entire career. I think that there are probably certain challenges that are specific to women in the tech sector. Can you maybe address how you see women being able to move forward in this environment?
I think it's starting to happen. I think there's been a lot of discussion. So I live in San Francisco in the heart of Silicon Valley, and there's been a lot of discussion around this. Everything from, we need to get women to start coding when they're like 5 years old, or maybe fall out of the crib and start programming BASIC on their iPads. I don't know.
Right.
I'm not sure that that's all the solution.
Mm-hmm.
Right. I think part of the solution is when there's a critical mass of women in any sector, or critical mass of any minority in any sector, people start to identify and get comfortable with the different styles that each of these groups bring. And so the more that we can make women visible, because they're out there, right? The more that we can make women visible and women as role models, I think helps other women sort of look at that and say, hey, I can do that too, no matter what their talent that they bring into the technology field is. It doesn't always have to be coding.
Right, I think that's a great perspective. So, I wonder too, looking back on your career, is there something that you wish you knew 10 years ago that you know now that might have changed where you've gone?
I don't know that anything would have necessarily changed where I've gone. I'm pretty happy with the path that I've taken through the technology industry. But for sure, they talk about mentors and they talk about sponsors a lot.
Mm-hmm.
And that's something I wish I was a little bit more savvy about when I was starting my career, that there's a difference between a mentor and a sponsor. A sponsor might be somebody, or a mentor might be somebody who takes you aside for lunch once a month, right? Listens to some of the issues that you're having and really tries to give you some advice. A sponsor in the organization pulls you up, right? Kind of by your pants and says, this person is amazing. I'm, staking my credibility on them. I'm really sponsoring them throughout the organization. And you need both. And they're not always the same person. And by the way, women, it doesn't have to be another woman.
Right. Right. And so you yourselves, did you benefit from that kind of sponsorship at a certain point in your career?
I did.
Yeah.
I did. And I wish I had been more savvy about that earlier in my career.
Well, I think that's a great way to end on this conversation, because that's a new concept. I wasn't really, everyone likes to talk about mentoring, but really sponsoring it's kind of mentoring to the next degree, isn't it?
Yeah, absolutely.
So,
it's impassioned mentoring.
I love it. Well, Christine, thank you so much for your conversation with us today in the GuideWell Insights Lounge. I hope that you enjoy the rest of your time here at MediFuture. This is Kate Warnock coming to you live from the GuideWell Insights Lounge. We'll be back with you soon. Welcome, everybody. We're back here live at MediFuture. My name is Kate Warnock. I'm the social media manager for GuideWell. With us right now in the GuideWell Insights Lounge, we have Glenn Tolman, CEO and chair of Livongo Health. Sorry, I fell over that.
That's okay.
Welcome to our interview, Glenn. I'm happy to have you.
Happy to be here.
Well, Glenn, you have a very long and distinguished career in the data field in particular. I'm wondering, especially with Livongo Health, how do you see big data being leveraged to truly impact population health?
I think we're at a real transitional point in healthcare today, and for the first time we have the systems, the foundation in place to really begin to use big data. So traditionally, even electronic health records, where I spent a good part of my career, those were data gathering and data repository kinds of systems. But they haven't yet turned into real-time information systems. And so now the ability to go from a system that's in front of a physician or even in front of a health consumer, go to the cloud and real-time return information that allows them to improve their health is something that we've never seen before. And I think it's going to fundamentally change healthcare.
Right. Well, you were suggesting in an article that you wrote recently in Forbes that we need kind of an Uber to happen in the healthcare industry. So I think the challenge is, the healthcare industry, as certainly very well, is so highly regulated. How do we bring about that kind of disruption, very consumer-facing, like an Uber, yet get through all the red tape that the healthcare industry is regulated by?
Well, I think that what you're seeing today is you are seeing the consumerization of healthcare. I think with the Accountable Care Act, Obamacare, whatever people want to say about it, it is driving the consumerization of healthcare. And so we're seeing people start to get the navigation tools that they need. We're equipping people with dollars to go out and buy services, which they've never done before. And so as they learn to do that, it's going to be much more like Uber, which is you're going to have a mobile device, a telephone. You're going to be able to say, talk to me, and you'll be instantly talking to a physician or a nurse or a care navigator. You can say, schedule me, and they'll schedule you. And finally, you can go through and get information that's real time. In today's environment, you can go out and you can go on WebMD or you can go on Google, and you can get information that in the past was never available to normal people like us, to health consumers. And I think that whole idea of moving from patients, which when you think about patients, you're talking about after the fact, to a preventive value-based model where we're talking about health consumers, that's a different change, and it's so transformational that it will have a ripple effect throughout the whole system. So this is a very different time.
Well, I think that's a great lead into our next question. Obviously, consumerism is such a focus at MediFuture. It really is about putting the emphasis on the individual. Yeah, in another role that you've been in, you helped to transform a company that had been doing not so well, and you rebirthed it basically to be a phenomenally successful enterprise. How is it that you win the hearts and minds of the people that work for you to produce the kind of output that you would like to have from them? How do you make them be a consumer within their own company?
Well, I think the first thing you have to start with is vision, and that is, what are you trying to accomplish? And in healthcare, we have this great advantage, and that is people who work in healthcare generally want to help other people, and they want to make a difference. And if you can get people to buy into the vision and the mission, what are you trying to accomplish? At that point, the rest really becomes easy. Then you have to treat each person as an owner, and you have to give them stock in the company. And when I say that, I mean, it's beyond just giving them stock as we hear of today, but it's really giving them an ownership piece of the company so they know what they have accomplished, how they're successful, and the like. So the clearer you can make the goals, knowing that those goals are important. You know, when we look at investments now, and everything we do is about how do we make a difference, how do we do that at scale, and how do we create a great company that we'd be proud to work for. And if that's the approach, it's amazing the kind of people that gravitate to you. And then you just have to take great care of them, which means really staying out of their way in most cases.
Right, right. Well, I think that your background too, I wonder, you're obviously a tremendous leader. You know, you have both the skill sets for the industry side, you have the people skill sets as well. And I'm wondering, you know, I see from your background that you have an advanced degree in anthropology from Oxford. You've always been fascinated by people. I'm wondering, you know, do you think that in today's environment, which is putting much more of an emphasis on students going into STEM careers, you know, science, technology, engineering, and math, is it still worth pursuing a liberal arts education so that you do have a really well-rounded workforce?
Well, it's a great question. It's a challenging question. I think first we have to start with the basics. Whatever you do, we have to improve our education system. And that starts from K through 12 and then moves into college and then moves into advanced degrees. So one, we have to step up our game there. And a big part of the way to do that is to use technology again, which is there's no reason in today's environment to have a professor stand in front of a classroom and repeat the same lecture 4 times a week, as happens in many of our top universities today. That's just not necessary. Those professors ought to be used to engage the students, and the students aren't going to sit there and watch it. They're used to social media, they're used to an interactive kind of environment. So one, we have to first and foremost change the learning environment. Then the second thing we have to do is make sure that we balance STEM, which is unbelievably important, and everybody, including liberal arts people, ought to have some element of STEM in their education. Everybody ought to understand how computers work, how networks work, what the scaling effects are, and the like. But then we ought to pair that with the arts and liberal arts in particular. So I'm a graduate of a liberal arts organization. I'm a big believer in the liberal arts, but I don't think you get a pass on saying because you're in the liberal arts, that means you don't do very tough work, very challenging work. And I also think that, you know, we ought to promote more than ever before the sciences and engineering and the like, because those are going to be critically important. You can't have one without the other. And I think thinking we can do one without the other can't do that. I also think in healthcare in particular, what we're seeing now is physicians who are also business people. They're going back and getting MBAs. And we're seeing the crossover. We're seeing artists who are using the latest technology to create new kinds of impact. So I think it's all about a blending, but we've got to step up the investment in education, and that's ongoing education for all of us.
Right, right. Well, I love that ending note on education, because I think obviously what we've seen here at MediFuture, all of our attendees have a diverse background, but they bring to the table their passion, their insights into what can happen in the future, and really putting the people at the core of that solution. You know, I think the more well-rounded we have as a student population, the more innovation we're going to see in the future. So,
I agree.
All right, well, Glenn, I can't tell you, thank you so much for being in the GuideWell Insights Lounge with us today. My name is Kate Warnock. We'll be back again with you soon.
This is live, so
Okay.
the camera is actually an audience, so
Okay.
don't be afraid to look at the camera.
All right.
Welcome back, everyone, to MediFuture 2024, Day 2. My name is Kate Warnock, and I'm the GuideWell Social Media Manager, coming to you live from the GuideWell Insights Lounge. I'm so honored today to have Dr. Brenda Dietrich, who is an IBM Fellow and Vice President with IBM Watson, with us here today. Brenda, welcome to the Insights Lounge.
Thank you.
Well, Brenda just came off her keynote address, but I wanted to start with a question based on your own background. No one here probably at MediFuture has a better idea of the value of big data and its application to helping to solve consumer needs and specifically consumer healthcare needs. Can you tell us realistically where might we see big data take us in the next 12 to 18 months?
Well, big data has had a huge impact in many other industries, less so thus far in healthcare. And one of the factors that's delaying the use of data in healthcare is that we're only just now beginning to have the electronic medical records, the detailed descriptions of what has actually been done with each patient, diagnoses, treatment, medications, etc. So that will build over the years, and I'm very, very hopeful it'll be a wonderful source of data in the future. But what we have now is literature, medical journals, medical textbooks, clinical trials information, etc., which is in natural language, which requires technologies like the Watson system to interpret, ingest, understand, and provide answers. We also have other sources of data which are just coming into play now. All of the devices that people attach to their body to keep track of their exercise, their sleep, their breathing, their glucose level, these are sending off a constant stream of data, which I think is going to be another wonderful source for understanding how actions, activities, etc., correlate with outcomes. And then there's a third source of data, which I'm not sure how to address now, but I think we need to start thinking about, which is all the social media information that's coming out, all the things people post, blog about, ask questions of their friends and neighbors about. Online, of course. People out there seeking other people's opinions. And I think this will give us a good sense of human behavior, human motivation, because these three things really have to come together. How do people think and behave? What is the actual impact of their actions? And then how can medical intervention affect these? And we really need all three. They're all three being built up simultaneously, and it may be easier to start tackling the social media and the streaming data off devices earlier rather than later.
Mm-hmm. I think it's a really exciting time to be in your field in particular. But I want to look back over the course of your career, Dr. Dietrich, and you personally hold 12 patents, if I understand correctly. So you must, obviously, you understand the value of intellectual property. Yet where we're going in the future seems to be more of an open API sort of platform. Yes. How is it that we protect the rights of the individual developer, yet still have that frictionless flow of information so that we have the best of both worlds?
Intellectual property is a really tricky subject because as we move into this collaborative world, and I'll give you a very concrete example. Suppose it's data coming from one organization. It's computing power and infrastructure from another organization. It's additional enriching data coming from a third organization, and it's algorithms and mathematics and modeling coming from a fourth player. And all of this is coming together to create a service that's being sold, that people are buying, sort of, by the usage. How do you distribute the money, all right? What's the relative value of each piece of this compared to the others? And that's something I think we're just beginning to figure out. And we're just beginning to understand what a data economy, where data is treated as a resource that is bought and sold and traded, just like other resources that we might be, buying and selling and trading in the marketplace. In terms of how does an individual who creates something get benefit from his or her own creation? Well, I work in a big company, and one of the requirements of being an IBM employee is what I invent belongs to IBM. So I've never really had to worry about this personally. The company benefits from it. I don't own my own patents. The company does. But for an individual entrepreneur who's invented something and really needs to be creating an enterprise based on that, the choices are go out and get investors and build out the solution end-to-end yourself, license it to a third party, take the licensing fee up front, or find a set of collaborators to work with where you're each bringing pieces of technology and you're sorting out this who gets what portion of each nickel. What's clear, though, is moving fast is going to be critical because many things are invented and don't make it to market in the hands of the initial inventor. Right? They're invented, they're patented, they're prototype perhaps, but it's really someone else who picks it up and can move very fast taking it to market, can learn quickly, fail quickly, refine and revise and build on top of that seed. So speed, speed, and more speed is probably my main piece of advice to people who are inventing something. I don't think the alternative of keeping it secret, hoping no one else discovers it, is really viable anymore, simply because there is so much flow of information and so much openness that, keeping it secret and trying to do something privately till you're done and then announcing it to the world, the chances are someone else is going to co-invent, reinvent, or unvent the same thing in parallel. So those are the choices. It's a tougher world now.
Well, I think that with so much of the conversation here at MediFuture this week, it really has been around collaborating with the right partners. And so I think you really surface a very interesting issue that's maybe not been front and center here. We've been really talking about the consumer focus. But truly the people that are involved with this is really at the core of what they're doing. So I think that's an important conversation for us to have, and I appreciate your insights on that. And my final question for you, Dr. Dietrich, I would love for you to address there's a rising population of girls who are considering a STEM career, and some still have that reticence of being the only girl in the class. How is it that you would advocate or tell them to have the courage to take that step and move into a career similar to the one you have?
Being the only girl in the class, you bring back lots of high school and college memories there. Do what you are passionate about, what you enjoy, and what can make a difference. And when I was coming up through college and even graduate school, the number of careers that could have impact on the world at large that were based on mathematics or statistics or some numeric dimensions of computer science were very small. I think my professors assumed I would grow up to be a professor and influence only those who I taught. I think now, with the underlying technology that we have, the ability to capture data, analyze data, make decisions based on data, and flow recommendations out to the general public through this wonderful thing called the internet, the opportunity to use science and mathematics to really change the world is far greater now than it was when I was coming up through college and graduate school. And I really think the big breakthroughs in improving quality of life, quality of health, equality, are going to come from the use of data and analysis of it. So it's a chance to change the world, and if you keep those goals in mind, you know, the fact that you might still be the only girl or one of 3 or 4 in a class of 20, it's only for a few years, right? You'll get through college, you'll get through graduate school if that's where you go. You'll face probably similar demographics in the workplace, at least initially. So, you know, view this all as a training experience for having a really rewarding and fulfilling career in this field.
Well, I think you make it. I don't think there's a more compelling argument to say that you can change the world with the choice of your career. So with that, Dr. Dietrich, I want to thank you so much for being with us here today in the GuideWell Insights Lounge, and I hope that you've had a wonderful experience here at MediFuture. My name is Kate Warnock, GuideWell Social Media Manager. Thank you so much.
Hi everyone. The changing world of healthcare gives people control, responsibility, and more choice, but many have less confidence in what to do next. Health is personal, and everyone's needs are different. People are looking for a complete solution that's simple, addresses all their concerns, and fits their lifestyle. That's why, at the beginning of 2014, we introduced GuideWell to the marketplace. At GuideWell, we are building a new world of health and healthcare resources, collaborating with and creating a spectrum of forward-thinking companies that offer a broad range of health-related products and services, integral and useful to people's everyday lives. With our experience and broad view on how to improve the cost, quality, and access of healthcare, we advocate for a better system while reimagining and reshaping the future of health and healthcare. GuideWell is a mutual holding company and is the parent to our family of companies. These companies, which are focused on transforming healthcare, include Florida Blue, Florida's Blue Cross Blue Shield plan, which provides innovative health solutions and insurance plans to the people of Florida. Florida Blue has served Floridians since 1944, offering an array of health and wellness products and services to fit the individual needs of those we serve. GuideWell Health focuses on transforming the delivery of care and delivering superior health outcomes and experiences to patients through new, innovative care delivery models such as GuideWell Emergency Medicine Doctors, a full-service, standalone medical facility serving the Orlando metropolitan area. GuideWell Connect, our marketing and retail services business, helps clients connect with their customers and provides them with the support they need. And Diversified Service Options, which provides administrative and claims processing services for state and federal healthcare programs such as Medicare and Medicaid. Our family of companies are guided by the same mission of helping people and communities achieve better health. The same vision, to be a leading innovator, enabling healthy communities, and values to guide our behavior: respect, integrity, imagination, courage, and excellence. Through innovation and collaboration, we are forming an integrated ecosystem of products and services which will enable consumers to better manage their health. We believe that by empowering and engaging people, we can improve not only their healthcare experiences, but also the overall affordability of care and individual health outcomes. The only thing certain about the future of healthcare is that it's changing, and changing fast. It will constantly be a moving target. We have created and positioned GuideWell to not just meet demands today, but to meet, anticipate, and create solutions for the future. That's the future of health.
Welcome back, everyone, to MediFuture 2024, Day 2. Hi everybody, we're coming to you live from day 2 of MediFuture. My name is Kate Warnock. I'm the social media manager for GuideWell. I'm delighted to have with us here today Ms. Renee Finley. She is the Vice President of Innovation for GuideWell. Welcome to the GuideWell Insights Lounge, Renee.
Thanks so much, Kate. I'm delighted and thrilled to be here.
Well, we're happy to have you here to help close out what has been a really remarkable 2 days. You know, Renee, I know that the GuideWell exhibit here, the living ecosystem, just generated tremendous buzz among the participants. I was wondering if you could share with us what were the elements within the experience that really got the most comments?
Sure. So we're really pleased with the way the MediFuture participants responded and provided feedback to our Healthy Human 2.0 exhibit, which was designed to really showcase how GuideWell is placing the consumer at the center of managing their own health care. When meeting them where they are, whether that's in the home, whether that's in the office, or in new care settings. And we are really appreciative of our partners that collaborated with us in this effort. We had MetroNap's sleep pods, we had the HealthSpot remote healthcare pod, and then UCF Metals Lab in our collaborative intelligent mirror.
You know, I did hear that the sleep pod was extremely comfortable.
Yes.
I heard that from more than one interviewee who decided that they needed to check it out. So, you know, I think that what that speaks to is Hi everybody, we're coming to you live from day 2 of MediFuture. My name is Kate Warnock. I'm the social media manager for GuideWell. I'm delighted to have with us here today Ms. Renee Finley. She is the Vice President of Innovation for GuideWell. Welcome to the GuideWell Insights Lounge, Renee.
Thanks so much, Kate. I'm delighted and thrilled to be here.
Well, we're happy to have you here to help close out what has been a really remarkable 2 days. You know, Renee, I know that the GuideWell exhibit here, the living ecosystem, just generated tremendous buzz among the participants. I was wondering if you could share with us what were the elements within the experience that really got the most comments?
Sure. So we're really pleased with the way the MediFuture participants responded and provided feedback to our Healthy Human 2.0 exhibit, which was designed to really showcase how GuideWell is placing the consumer at the center of managing their own health care. When meeting them where they are, whether that's in the home, whether that's in the office, or in new care settings. And we are really appreciative of our partners that collaborated with us in this effort. We had MetroNap's sleep pods, we had the HealthSpot remote healthcare pod, and then UCF Metals Lab in our collaborative intelligent mirror.
You know, I did hear that the sleep pod was extremely comfortable.
Yes.
I heard that from more than one interviewee who decided that they needed to check it out. So, you know, I think that what that speaks to is that there are solutions that are here today that are still so innovative. Hopefully we get to see them on a grander scale, but I think it's wonderful that we brought them here to MediFuture so that more people could experience them firsthand.
Absolutely. You know, I think the solutions that resonated most were the ones that were closest to market ready,
right,
and the ones that were closest to our core healthcare delivery.
Right.
So the pod certainly was one that resonated because it was something a little closer to home.
Right. And I think too, the HealthSpot was remarkable in that I think that's going to bring care delivery to areas where maybe it's underserved. You know, so we had some Moffitt Cancer Center folks walk through, and the first words out of their mouths were rural health. This could be a solution. So again, I think that was just tremendous demonstration of where technology really can be now, and you know, with the mirror from UCF Metals Lab, that where it can be in the future too.
That's right. And you know, it really is about meeting people where they are and giving them the solutions at the point where they're making decisions. And so if we can be in the home setting where behavioral choices are being made, we feel like we have those moments of influence to be able to share information and insights to connect with consumers in a different way.
Right. Well, with that, what have been some highlights for you from MediFuture? We've had a lot of conversation around consumerism and things that I know just really are so closely aligned to GuideWell's vision and mission. What did you take away personally from this experience?
You know, I really was compelled by Adrian's opening session where he talked about this converging value chain and both the threat and opportunity that that's bringing to the transformation of healthcare. And as we're looking at this time to be able to leverage that to need to record because I'm not good live.
It's okay. Do we want to start the question over?
Yes.
Can we start from question 2?
I don't think I answered your first question either.
I'm not really sure that you did, but you know.
Do you want to ask it again and we'll start from there?
Can we start from the top, guys? Is that okay? Actually, we okay.
Some of the highlights.
Yep. Okay. So Renee, you know, as being part of MediFuture, I know we've had some, you know, amazing thought leaders here, a lot of disruptors. What did you personally take away from MediFuture?
I really was compelled by the conversation that Adrian led around the convergence of various value chains, whether that's telco, technology, retail, and the impact and opportunity that can have on the transformation of health. I think it presents tremendous opportunities as we start to look for these new solutions that can operate in this integrated platform to inform and engage consumers in their management.
Right, right. So it really has been just an amazing experience, you know, with all of these different brilliant people that are here that have been speaking, that really it's all about how do we advance care for the regular consumer and make sure that they are empowered and equipped with the right information when they need it.
Absolutely, and you know, the conversation around transparency and actually the simplicity that's needed in healthcare delivery was also quite compelling. The panel discussion of the Gen Ys, I thought they articulated extremely well, where they talked about wanting to have insights and not instructions. And the opportunity for us as innovators in healthcare is to really think about creating moments of influence that are zero interface, that require little consumer interaction, that they're almost ambient to the way that we're living our daily lives.
That's a fascinating way to put it. I really like that. So it's there when you need it, but you're not really even cognizant of looking for it. It's just there, and available for you. Well, Renee, are there any closing thoughts that you have for us as we bring MediFuture to a close?
Yeah, you know, I think one of the underlying themes out of MediFuture was really the power of collaboration, and that by bringing all of the ecosystem partners together in meaningful dialogue, we can start to reshape the future of healthcare. And I thought that Rishika from Iora Health really provided a compelling case today around how to approach innovation. And he had 3 key lessons learned that I would reiterate. One was be agile, right? Be willing to pivot. Be willing to take the risks.
Right.
And thirdly, if we're not upsetting someone, we're probably really not innovating, right? So I thought that was great advice for all of us, is to push those boundaries. And I would just leave with this final word, that if we're not living on the edge, we're probably taking up too much room.
All right. Well, I can't think of a better way to bring MediFuture 2024 to a close. It has been a delight having you here, Renee, and we're so thankful that you joined us for these past 2 days at MediFuture. My name is Kate Warnock. Thank you so much.